keep posting your questions in the conference app so that we can queue them up for the end of the 1 hour. We will not be taking specific questions after each speaker. Since all of the topics are related, we will be taking a dedicated 10 minutes Q&A session at the end of all the speaker presentations. We have a stellar lineup of the best talent in AI and oncology to help us understand the advancements and spark those neurons just to see how effectively AI technologies can be leveraged for social good. We have received some feedback from our videographers, and specifically for the speakers, we have now demarcated an area on the stage which is the best for videography, both of the speaker and the presentation. So I would request all speakers to use the demarcated square and position themselves so that we have a complete videography available. This is the QR code for our opening speaker for the session, Geetha Manjunath, PhD. She is the CEO of Soni Rama, and she will shed light on one of the leading types of cancer, breast cancer, which is the leading cause of death for women in India today. According to WHO, 1 in every 12 females have a risk of breast abnormality. Indian females have only about 50% chance of survival once detected. Early diagnosis is very critical to decrease mortality rates. With ample contribution of AI in medical sciences, cancer detection has gained a lot of attention by AI researchers to develop robust methodologies for the same. It is our immense pleasure to introduce Dr. Geetha Manjunath, who has been a great contributor to this domain. Geetha Manjunath is the founder, CEO, and CTO of Soni Rama. She has over 25 years of experience in IT research and has led many innovative projects in healthcare and transportation, specially catering to emerging market needs. Until the end of 2016, she was a lab director heading data analytics research at Xerox India. Prior to that, she was a principal research scientist at Hewlett-Packard Laboratories for 17 years and a member of CDAC team, which was the first one to build commercial supercomputers from India. She holds a PhD in computer science from Indian Institute of Science and Management Education and Kellogg's School of Management, Chicago.
There is interest in career growth and so on, so we are divided, but wonderful to see half the room full. After that wonderful talk about how AI and data science is affecting smart cities or making Pune smart, we now move on to healthcare. And as was mentioned earlier, we are going to focus on cancer. Is there a... No. When I just... Okay. So Soni Rama is a startup that we started 3 years ago just to try and save lives from breast cancer. I was actually working on several other problems, and when one of my very close cousin sisters got detected with breast cancer and she succumbed to it, I said, let's do research in this. And that's when Soni Rama was born. And yes, Soni Rama is one of the leading causes of cancer. 25% of all cancers in women happen in the breast. And like mentioned before, 50% of them, that is every alternate lady detected with breast cancer, is dying today. The unfortunate thing is, nobody needs to die of breast cancer. It is one of the simply, very easily, very effectively curable disease. There are many women who have had breast cancer and lived 30, 40, 50 years after that. I have met those people, cancer survivors. The only reason so many women, 86,000 women died last year of breast cancer. And the only reason they're all dying, mostly, right, is late detection. They wait till there's a huge lump before they even tell others about a problem. What needs to happen is a regular screening for breast cancer every year, so that if there's any early signs, not symptoms, early signs, and you'll see what that signs is, then you just take some immediate action and everything will be fine. Just like, you would measure sugar levels, right? Every year, one could go for a sugar test after maybe 30, 40, And then if the level is, let's say, 120, you stop taking sugar. Same way, right? If you know the breast health, starting from 20 years, not 45 years, and we'll talk about what that is the way you can actually stop deaths due to breast cancer. And that's the motto of Niramai at this stage. Next slide, please. So obviously you will ask the question, what is stopping early detection from happening? One is awareness. I'm sure at least 50% of you did not know that 1 in 25 women can get a breast abnormality, and that everyone could be saved as well, right? So now, apart from the awareness issue, there is also a technology limitation in today's methodology. The most common method of detecting breast cancer today is called mammography. Mammography is basically an X-ray of the breast where you will see small lumps kind of a thing, which will be shown as white. Because when you take an X-ray of the hand, what happens? The skeleton appears white and rest appears black. The same way, if there's an abnormality, that appears white. However, when you see the two images there, the first one, the left side for you, is about 40-year-old having cancer. The right side, sorry, the first one is a 60-year-old having cancer, and the right side is a 40-year-old having cancer. So what is happening is, when a lady is under 45, or even some of the people elder also, who are called what's called as dense breast, will have a white, there's more fibroglandular tissue, and the whole thing will appear white. And how do you find a white spot in it? That is a problem, and hence mammography does not work on almost 50 to 60% of the ladies who go into having this test. And the number of cases between 30 and 40 years of age is growing, and it's one of the peaks in India. So how do you solve this problem? We need to figure out a different way, not using X-rays, because X-rays won't work. Physics has a limit, because of the physical limitation. So you need to find another way of detecting cancer, another modality, another signal of detecting cancer. Second huge problem is the affordability. It's very rare that you can actually spend 3,500 rupees every year, when you're well and so on, going and doing this test, right? It's a pretty big amount for a mammography. Can we make it much, smaller, much lower, is the next part, right? And of course, when you go to rural areas and so on, right, absolutely no mammography machines. In fact, only tier 1 and tier 2 cities today have a mammography machine. Talking about accessibility, 60% of the ladies are outside the cities. They do not have access at all. How do we enable this screening outside the hospitals, closer to the rural areas and so on? Next, I mentioned about X-ray, right? It is about X-ray of the breast. And you know that X-rays means radiation exposure, and it can increase the risk to cancer. So you cannot take a mammography test every year or something like that, right? Because you are exposing yourself to additional radiation. And so here is a test which is the best known test for breast cancer. By the way, if that test is taken every year, the person can get cancer because of the test. It's the most horrible situation the disease is in today. And the good news is we have a solution which can be solved. And the better news is the solution is completely based on data science, especially for this community. So the next slide is saying what that solution is. Oh no. So we start with, as I said, we cannot do with X-rays because of radiation, because of the issue of finding white spots in a white breast, right? So we start with a different sensing modality, what's called as thermography. Thermography is just measuring the temperature variations on the skin, okay? When I started this research, right, started reading about other imaging modality, because my cousin sister, when she died, was 38 years, and I knew that mammography cannot actually solve this. So when we looked up, and I discussed with imaging specialists and so on, we figured out that there is this modality called thermography, which was already approved as a modality for detecting breast cancer, but it's nowhere anywhere in the picture. Nobody is using it. I said, why? Why not? It turns out that it is possible to find early signs of increased temperature at the lesion's location using a thermal sensor. Its thermal sensor is like almost like a camera, infrared camera. Basically, it's placed in front of the person, and she sits like this. It's just like a photography session. Nobody touches the person, nobody sees. Very simple, just measuring the temperature. The problem is, every abnormality, every cancer may have a high temperature and a sort of variation in the abnormal pattern of heat distribution. However, anything that is hot is not cancer. The false positives are huge. 60% of the ladies you screen will have a red spot. What do you do? Obviously, none of them are cancerous. So that is exactly where we wanted to bring in machine learning and computer vision-based techniques. Next slide. This is the technology, next slide, we call as thermalytics, thermal analytics. And this is a trademarked word by Niramai today, because we've been working on how do we analyze these thermal signatures to detect different abnormal patterns and build models which can accurately detect cancerous and non-cancerous lesions. And this we have been working on now like 4.5 years, though the startup is 3 years old. So here what we do is we measure the temperature variations, and then, okay, that's gone, but basically use machine learning to analyze those, and then show the areas of likely abnormality. We are not saying she needs to go to a treatment immediately. We are identifying likely abnormalities in the tissue. There you can see the annotations and so on. I'll go into more details of this. And all this is done automatically. All this is done automatically means even a simple skilled person can do the screening. And all of this, like most analytic solutions, are hosted on the cloud. So if there is an abnormality, a doctor can come in, log in, check, and then give the result. So this immediately improves the scalability of the solution. Next slide now. So we don't look for lumps, we look for cancer. We look for abnormality, because 70% of the lumps are not cancer. It's not about looking for lumps. It's really about abnormal tissue activity. And that is what we try to detect. So overall, what happens, first of all, even before a lump is felt, instead of detecting a 25 millimeter lump by hand, now with this, we are able to detect 4 mm lumps or lesions, right, which cannot be felt, and much earlier. And as I mentioned, it's like a photography session. Nobody sees the person, nobody touches the person. It's like a booth. In fact, we are doing this right one block that side. I really encourage each one of you to go. It takes 10 minutes. Just go sit in front of a device and come out. You just get a breast health report. I promise you, none of you will have abnormality. Just go and get the test. It's a huge relief. You can look at it like a demo. And it's absolutely no radiation. We're just measuring the temperature variations on the chest. And it does work for women of all age groups. A 17-year-old cancer patient is somebody whom detected in a hospital, actually, when we were doing the trial. And a 92-year-old walked into our camp in a rural area, and she was, good, nothing, very nice. So yes, it is very portable, light, and so on, and you have to see the device there. Next slide, please. So it looks like this. There's a small tripod on that you just place. It's an off-the-shelf device. It's a thermal camera which you can buy on Amazon.com.in, right? But the magic is in the analysis of these thermal signatures. Next slide. So, so you can also do it outside. You can create booths where the lady enters, sits in front of the device. She comes out after 10 minutes. Her report will be ready. Nobody has seen her. Nobody has touched her. We also have a bus which was contributed by Rotary. Next slide. There's a small experience video of 10 seconds, and then I go into how it works. No, video is gone. Before that, yeah. This doesn't work? Okay. Fine. Can you click on that and see? Okay, fine. You come and see live. Okay, next slide. So we'll talk about how this works. We'll just skip. Next slide, yeah. So the core innovation, as I mentioned, is to reduce false positives, right? There are 4 women here. I don't know how many of you can see it. I'm supposed to be standing here, so I'm not able to move. So there are 4 people here. One, that side, right corner is the cancerous patient. There is a pink border there. And that's a normal patient. This is what's called benign. There is some lesion, but it's not harmful. So there are many women like this with the red spot, asymmetry, because one of the main things is the asymmetry between the left and right side. We leverage a lot for doing this analysis. We use a lot of demography information. We also have handcrafted asymmetric pattern, which have, like for example, we are able to detect vascularity automatically. The blood vessel structure is right under the skin, and we are able to detect how the blood vessel is flowing. And so, incidentally, what happens if there is cancer in one breast, there's more blood vessel activity because it requires more food, right? It's kind of working hard. So that difference is something that we can figure out. We also look at hotspot boundaries, shape characteristics. Of course, we do have deep net unexplainable features as well in addition. So next slide. So with this, next slide. Yeah, with this, as usual, there is a machine learning training and prediction mode. But the beautiful part of it is here, when you're trying to sort of analyze imaging and you're trying to annotate images, what do? You ask people whether there's a dog, there's a cat, there's cancer, whatever, right? But we don't have doctors today who are using this very, very regularly. Of course, there are 500 doctors in the whole world. And so it's very difficult to get them to sort of, tag your images. So what we did was we made the people go through thermal imaging. The same people went through mammography, ultrasound, and biopsy, and we tagged using this alternate modality. That's biopsy. So by design, this is tagged by biopsy, means it is better than mammography. It's definitely better than people who are using thermal imaging for analysis. So that's what you'll see in the results. Next slide, please. Next. So yeah, so we'll show the results. And so it's not just about doing whether yes or no. It's not just about malignant or not. We actually have 10 plus machine learning models in this whole pipeline. For example, when a lady is using it in a village, trying to do the screening, I told you it doesn't require a doctor to do the test. She can make mistakes. So our tool actually figures out, is the image quality good? Is it focused well or not? Is the position okay or not? All these are machine learning models. Once you take an image, you take the full breast area. So where is the breast region of interest is a machine learning model. There's so many of them, right? Different computer vision algorithms form this full pipeline of saying yes or no. Next slide, please. So some examples of what these are. First and foremost, we take 5 views: frontal, left 45, left 90, right 45, right 90. She's sitting on a stool and moving. I would have seen it in the video, but you'll see live. Now, here, it is about like some of these initial screenings, they used to mark left as right and all that type of thing, and they were not taking the right view. So first, we came up with a view labeling methodology. 5-class classifier, and we say which view it is. Deep learning works beautifully here. First, we tried with just imaging, because every bit of this image we had to collect. So initially, we did not have so much of training data to feed into a deep net, right? So initially, it was an image processing-based methodology that was about 75% accurate. Now we have 97% accuracy in, detecting the view label. Next slide, please. Then there is the ROI segmentation. In this whole image, where is the breast area? That needs to be, analyzed. That again, we did first with the image processing. It was about 70% dice similarity with the manually, segmented image. Next slide. Now we have actually brought in a CNN-based approach, where first we do the view labeling to figure out which view it is, and then do a methodology called flipping, so that we can increase the number of training samples. And then we do the segmentation using CNN and also VNet right now. And it works pretty well. Next slide, please. You'll see some examples of the blue is image-based, and yellow is image-based, and green is, DNN-based, imaging versus DNN-based. So it really, really works with 92% dice similarity with manual segmentation. So what it means is everything can be automated, right? When there is a doubt, when there is a, confidence level issue, then we actually can watch it and then fix it. Next slide, please. Then we also have handcrafted features, about 117 handcrafted features, but of course, we have to use DeepNet for database decision-making, further statistical database decision-making. So there, we use VGGNet. In fact, Minerva, who works on this problem, is in the exhibition area. You have to chat with her to see how this works. So it extracts about 512 features, and that's also fed along with the semantic features. Next slide, please. All this put together generates the full 3-page PDF report automatically. Automatically it is generated, and this report goes to the doctor. Doctor reviews it, looks at the scores. We have something called thermobiological score, areola score. So these 3-4 scores, the doctor looks at it and then certifies. Next slide. We image, like we annotate the image. We say, here is the problem. You can see that in the first image, there's a marking, like a star-like marking. That's automatically done as well. However, when we go to the villages and so on, we can't wait for the doctor to say yes. So there we do end-to-end automation. We automatically give the red, yellow, green in the community screening. Within 15 minutes, the lady enters. She actually has a small thermal printer scan, less than 15 minutes. And then if there is a problem, we take her to the hospital for further tests. And this is completely automated, all using machine learning and high confidence machine learning. Next slide, please. So obviously you'll be thinking, is it really working? You're not telling me the result of the accuracy of the end result. Yes, we actually were selected as a breakthrough idea, top 50 breakthrough ideas in the American Society of Clinical Oncology. It's an international breakthrough summit. We were under the top 50, because we got 100% sensitivity in asymptomatic women and with 93% specificity on 769 patients. It's a very big data set. Most of the papers today talk about 250, 300. We actually did this on 769 patients. This is a very, very formal clinical trial. Of course, our test has been taken in by 30,000 more plus women who have done only this test, only if positive they've gone forward and so on. The 769 went through all of those, right? So that's, this is the first time screening people. There were many women who are screening after they got cancer and, trying to see if there's a follow-up issue and so on. Next slide. You will also wonder, is it working better than mammography? Next slide. Yeah, so actually when you compare, mammography got 66.7% accuracy on this, on the asymptomatic women. That's how the different the results are. Other important pieces, I mentioned that mammography doesn't work for women under 45 years of age. And so this was applicable only on about 400 patients out of 769. 269 women could not go through mammography. We had to send them to other type of tests to actually validate our thing. Next slide. So, of course, this is deployed in many district hospitals, and just 2 minutes, yeah. So this is Maharashtra State Innovation. I thought I'm talking to Pune, and Pune has been our first district hospital official pilot installation in a government location. And they were so happy using it for 3 months. We have now installed it in Thane as well last week onwards. So it's working really, really well. And I encourage you to send all your, of course, that's free there, and we are doing the test there. And it's installed in more than 50 hospitals today. Next slide, last one. We have actually won many awards, international and national awards, and also, a grant from Bill Melinda Gates Foundation. But my favorite, next one, is this one. I don't know how many of you can see. This is the top 100 AI startups in the world. And India is blue because of Niramai. Jai Hind. Thank you. So I understand there's no question answering now, but we'll be very happy to answer any questions now or later.
So I'm just going to be telling how many questions we received. We have received 14 questions for your session so far. We are screening them, and we'll be taking everything in the end after the entire oncology session is over. Thank you so much, Geetha ma'am. It was extremely insightful, and I'm sure all of you data scientists out there can now understand the applications of AI real life for such an important and impactful issue like cancer, and that to breast cancer. And this innovation, and this innovation is being displayed live at their demos. There's a Niramai demo booth in the exhibition area. So I request all of you to make use of this demo and go and get yourself scanned. Okay, so the test is happening at the Dean's office. It's not in the exhibition area. Thank you so much.